Hi everyone, I'm JJ Ferguson. I'm thrilled to be here to discuss one of the most important elements of managing a client, and that's the medical screening for referral. So by the end of this presentation, you'll be able to describe the purpose of a medical screening for referral, differentiate between a review of systems and a systems review, and then you'll be able to outline the process of performing a medical screening for referral. So before we dive into the content, I want to stop and think about what we're doing in the clinic. So first, let's imagine we're in an outpatient setting and we have an initial examination with Herlinda. Now, Herlinda, all we know is that she's direct access and she's coming in with reports of upper back and shoulder pain. So I want you to think about how do we determine if these symptoms are musculoskeletal in nature? And so, in other words, how do we determine that she belongs in our care? So I want you to go take a minute, pause this recording, and answer this question. Describe the process that physical therapists use to determine if a patient belongs in our care. I want you to think about your experiences in the clinic so far, maybe personally. What process have you noticed physical therapists are going through to determine that they are the right provider? So when we look at this process, it's known as the medical screening for referral. So it's not to be confused with medical screening used by MDs. Medical screening in that in that context, excuse me, is a method for detecting disease before an individual would normally seek medical care. So medical screening tests are usually administered to individuals who do not have current symptoms. That's known as the preclinical phase. What we're doing as physical therapists is we're trying to determine whether the current signs and symptoms a client has are related to a condition that can be addressed by the physical therapist, or whether the condition requires evaluation by another healthcare provider. So I like to think of this as a stoplight approach. So a green light would be the signs and symptoms belong in our care. They're musculoskeletal in nature, so let's treat. Then we have a yellow light. So these signs and symptoms, I'm not quite sure. I'm going to treat, but potentially refer. And then next we have basically a stoplight where these signs and symptoms do not appear to belong in the care of a physical therapist. I need to refer or consult with the appropriate healthcare provider. So I want to explain why is medical screening for referral important in the first place? Like, why are we doing it? I think first is the recognition of direct access. As more states move towards direct access, we might be the first point of contact into the healthcare system. So we must always ask ourselves, is this patient appropriate for PT? Next, I think a lack of a thorough medical screen upon referral to PT is something we need to be aware of. It's been found that 1 out of 3 diagnoses are incorrect, so I think we must never assume a thorough medical screen has been done. There's also an increase in comorbidities. Around 2/3 of the population has multiple chronic conditions that can significantly impact PT interventions. So it's important that we look at the patient holistically and not just the body region they might be coming in for. And then there's also therapeutic value in early diagnosis of serious conditions. We know that specific treatment, when initiated early, leads to much better outcomes than if treatment were delayed. And then lastly, we want to identify red flags and yellow flags. So red flags are signs and symptoms that raise suspicion of serious pathology. So when we look at the process for medical screening for referral, it's done in 2 different time points. First, we have the review of systems. This is done during your history taking. Following that, we then have our systems review. And I want to take a closer look at each of these, starting with the review of systems. So the review of systems is a systematic method of gathering subjective information about current signs and symptoms and overall health across the various body systems. We do that by reviewing past medical history, personal and family history of different pathologies, and then we want to try to identify the signs and symptoms and see if they're related to red flag pathologies that we know. So a review of systems is done usually through 3 different ways. So first, we'll use what are known as medical intake forms. After that, we're going to use a series of just general health questions. And then we'll use red flag specific questions. So that's linking our knowledge of signs and symptoms to a pathology in the moment with a client, and then asking certain if there's other signs and symptoms that maybe the client doesn't want to share. One pathology that comes to mind is Cotter-Aquinas syndrome that you'll learn about, and that can affect the client's bowel and bladder function. So we'll want to ask about that. So here's an example of a medical intake form that I use in the clinic. So the circle here, the red, are signs and symptoms that are red flag in nature, and I want to know about that. Sometimes clients don't offer that up. And here's the back, which talks about the behavior of symptoms, and we'll talk a little bit later about why that's important to understand. So next I want to now shift gears and talk about the systems review. So the systems review is referring to the hands-on physical examination portion of different body systems that are related to your red flag hypotheses. So in other words, you can see this list of all the different body systems. We wouldn't do a physical exam for every body system, only the ones that we think the signs and symptoms are correlated to. So if somebody's having shoulder pain and we think it might be cardiovascular in nature, we're going to assess that. So usually our red flag physical examination techniques take place in the form of vitals, a neurological examination, and then you're going to learn a plethora of different red flag special tests that are correlated to each body system. Okay, so let's revisit her, Linda. And imagine now that we have just finished a review of systems during the history taking, and we gathered further data during our systems review and the physical examination. I hope you're asking yourself, now what? What do we do regarding these red flag pathologies? And I want to give you a sneak peek of the lecture coming up that builds on our discussion of medical screening for referral. So I think it's important to understand that the data you're collecting is only part of the equation. What truly matters is how we apply it to make informed decisions for patient care. So what we're going to be discussing is how to synthesize this information and take actionable steps in the clinic. So I want you to start to think about how would we manage someone with a suspected red flag pathology, and then we're going to compare it to the clinical recommendations that are coming up in our next lecture. Thanks and enjoy your day.